Hospitals around the country are gearing up in the face of Ebola, including those right here in New Mexico. Good evening, everyone. I'm Crystal Gutierrez. The governor wants to make sure in the rare case a deadly virus makes its way here, they're prepared. News 13's Cole Miller is live in the Newsplex with more on what the state is saying.
Now, Crystal, we also spoke with the state's epidemiologist, or the top professional when it comes to studying patterns and causes of disease. And he tells us the chance is very low here. And tonight, he tells us why. In the wake of Ebola making its way to the United States, one life has been lost. And now 2 nurses who treated that man are infected. This to our east in Dallas, Texas. And just recently, Governor Susana Martinez taking action.
Absolutely. There has been a preparedness plan put together.
She says New Mexico hospitals, in the rare instance they see the potentially deadly virus, are prepared.
We are ready to respond in just minutes. The equipment is there. They're preparing, doing dry runs, make sure they know how to put it on.
One of the state's epidemiologists, Dr. Michael Landon, says those hospitals are all following CDC guidelines, as well as tailoring plans to their own needs.
They also are working out details locally. So each hospital is different.
Landon says the big focus of Ebola boils down to travel history.
We don't have the communities of persons from those originating from those 3 countries.
Those 3 countries being Liberia, Sierra Leone, and Guinea. And being that New Mexico doesn't have large communities of people from those countries, Landon says that reduces the risk. Now, Thomas Duncan, that one death in Dallas, was visiting family and friends from Liberia. There are a few more differences between our state and Texas, according to Landon.
We also have a centralized health department. We don't have local health departments. We can react more quickly, we believe, to disease.
He also says New Mexico has a smaller healthcare provider community, making communication better. All things considered, they're taking the necessary steps.
We do have to be well prepared for the possibility. We do have to take this very seriously because the stakes around a single case would be quite high.
And officials say they've learned quite a bit from all that's taken place in Dallas. This especially goes for protective wear and protecting healthcare workers dealing with the disease. Crystal, back to you.
All right, thanks, Cole. Now, earlier this week, Christus St. Vincent Regional Medical Center in Santa Fe held a person in isolation momentarily after saying they had symptoms of Ebola. Now, shortly after, they were released from isolation as they did not meet criteria for the virus. That was based on their travel history.